Non-melanoma skin cancer represents the most common form of skin cancers. There are two main types: basal cell cancer, the most common, and squamous cell cancer. Both of these are caused by ultraviolet light from the sun. While anybody can develop non-melanoma skin cancer, people with light-colored eyes, fair hair, fair skin, a family history of skin cancer, are all at increased risk. In addition, people that have had blistering sunburns in childhood or work outdoors have an increased risk of developing non-melanoma skin cancer. Basal cell cancer most often becomes apparent to an individual because it's a non-healing wound. A wound that bleeds, heals up, and then comes back. Squamous cell cancer can often present as a small growth that erupts quickly and can be painful, or itchy, or appear red or irritated. Very often, a dermatologist can determine whether a particular bump or growth is possibly cancerous, and if so, perform a biopsy. A biopsy is an extremely simple office procedure in which the area of concern is numbed up with some local anesthetic, and then a small sample of the specimen is removed. The patient then leaves the office with a small Band-Aid and can expect to get the biopsy result within a week or so. The most important thing that you can do to minimize your chance of getting skin cancer is to practice safe sun behavior. This includes applying sunscreen every couple of hours while you're active outdoors, use one with a sun protection factor or SPF of 30, wear a brimmed hat, avoid the sun during the peak hours of 10 to 4, and importantly, practice self-skin exam so that you yourself can identify any growths that are concerning or worrisome. Basal cell cancer and squamous cell cancer are easily treated by any number of approaches. These include just scraping and burning the tumor off the skin, excision, in which the cancer is actually cut out, and the third technique is something called the Mohs micrographic method. The Mohs micrographic surgery technique is highly efficient and obtains the highest success rate of any of the methods. Mohs surgery is performed just like the other procedures in the office setting under local anesthetic only. In rare cases, perhaps less than 5%, squamous cell cancer of the skin can spread to other parts of the body in a process known as metastasis. When this happens, more aggressive therapy is required. However, the best way to avoid that circumstance, of course, is early diagnosis. I'm Dr. David Leffel, Professor of Dermatology and Surgery at Yale Medicine.